Hi there. Welcome to the Therapy Tips and Tricks channel. If you're a therapist, then you need to master writing effective therapy treatment plans. If you're new here, welcome to our channel where we share tips and tricks to elevate your practice. Today we will be diving into something crucial for every therapist writing effective therapy treatment plans. Whether you're just starting out or have been practicing for years, a solid treatment plan is your roadmap to successful client outcomes. Let's get started. First off, why are treatment plans so important? They provide structure, ensure continuity of care, and help track progress. Plus, they're often required for insurance purposes. Having a well-crafted treatment plan can make all the difference in your client's journey. Step 1. Start with a comprehensive assessment. You need to understand your client's history, symptoms, and current functioning. This forms the foundation of your treatment plan. Remember, the more detailed your assessment, the easier it will be to develop an effective plan. This may include a screening tool such as a mental status exam. Step 2. Define clear, measurable goals. Goals should be specific, measurable, achievable, relevant, and time-bound, or SMART for short. For example, instead of saying reduce anxiety, you might say, reduce panic attacks from 5 times a week to once a week within 3 months. Step 3. Outline the interventions. These are the specific actions you and your client will take to reach those goals. Be as detailed as possible. For instance, if your goal is to reduce anxiety, your interventions might include cognitive behavioral therapy techniques, mindfulness exercises, and regular homework assignments. Step 4. Establish a timeline. Decide how often you'll meet, how long each session will be, and the expected duration of the treatment. This helps set expectations and allows you to monitor progress over time. Step 5. Regularly review and adjust the plan. Therapy isn't static, it evolves as your client progresses. Check in frequently to see what's working and what's not. Be flexible and willing to modify the plan as needed. Finally, document everything. Keep detailed notes on your sessions and any changes to the treatment plan. This not only ensures continuity of care but also protects you legally and professionally. Writing effective therapy treatment plans might seem daunting at first, but with practice, it becomes second nature. And remember, a well-thought-out plan is a powerful tool in helping your clients achieve their goals. Thanks for tuning in. If you found this helpful, make sure to like, subscribe, and share. Don't forget to download our free therapy treatment plan template from the link in the description to get started right away. Until next time, take care.